Greetings to all our viewers. This is Head to Toe with Dr. Tebelele. We've got our guest, Dr. Mooi. Dr. Bongani. Mooi is a private general practitioner here in PE. Dr. Mooi, can you greet our viewers?
Good evening to all viewers at home and nakubo bonke bethu abukele le nkqubo emnandi kangangana ngokuhlwa nje siyanibulisa.
Thank you so much for honoring our invite and thank you for being with us. Dr. Mooi, there's a lot of talk about birth trauma, birth injuries. First, let me just take it lightly. Are men friendly to visiting labor wards during delivery?
Well, Dr. Tebelele, men are definitely not friendly. But ndiyafuna ukutsho into yokuba izinto zatshintsha lately. I'm tending to see a lot of men, especially kwindlu emnyama. Abantu bendlu emnyama, they don't really like going to a labor ward. Uthi sele ekhona iyile labor ward, afumanise uba akazomelana naye lento eyenzekayo pha aphuma baleke. But they really are scared of labor wards. I suppose ke kukhona ne-stereotypes ezikade zikhona njengoba umuntu ongutata or any other person for that matter ngaphandle komzali nomzalisi lo akavumelekanga uba ambone umntwana engekapheli 10 days. So ezaa stereotypes ndiyafuna ukube sike si-educate abantu bakuthi ukwenzela uba zisuke ezanto ngoba indlela ebaluleke ngayo the first few hours of life emntwaneni.
For bonding.
That's where the bonding begins to take place.
Izibhedlele zona ready for accommodate abantu. Let's say men become ready because there are so many men's conferences these days. Ready izibhedlele public and private to accommodate or data because there's paternity leave now and coupled with maternity leave. Are hospitals ready?
Kweli xesha siphila kulo le pandemic COVID-19, understandably so, izibhedlele are not in a position uba zinga receive abantu to come in and join during the birth process. Ubu-ready bazo, yes, izibhedlele are quite ready because I've witnessed quite a number of times where sibona izibhedlele zisenza i-arrangement zokuba utata angabe efumana igunjana lakhe elisecaleni ngexesha umzali okanye umama esalindele into yoba abe kanti uzisa umntwana kweli hlabathi. Yes, slowly but surely izibhedlele are upping their game in making sure that they are accommodative of the paternal side of abazali.
Lingakanani futhe elenziwa kuthatha inxaxheba kukatata kule process ye-delivery ingabi khona into eyincedayo in the whole process? Ngoba utata kalonyamoz does it play any big role?
You'd be surprised how much men go through the birthing process themselves xa unkosikazi ephaya kula process, and that gets to show how connected these two people are. We are seeing ukuthatha kwe-pain from umama angene kuye. Let's take an example where utata uzowitnessa i-delivery nge-cesarean section. Athi esangena nje axa ibona kuphethwe ezamela zinkulu kuzawusikwa umama ekhaya afeyinte utata ngoko nangoko. That seeks to say utata is taking the pain kankosikazi wakhe. But overall, inxaxheba ethathwa ngutata ibaluleke kakhulu in the sense that one, umama uzawufilisha into yoba I am secured here because my partner is here, my husband is here, I am safe here because naxa usenzeka into ekhayeni umuntu oqala ubizwa tata, so unela themba lokuba akho nto i-adverse enokundahlela because umyeni wam ulapha ecaleni kwam. And that is just the sense of security. That makes it even easier for this woman to go through this process because the pain azayiva uzayishare nalo tata, uzawukwazi ubambelela kulo tata xa funeka emtsukilile amtsukile, xa funeka emlumile amlume. And this man must just stand there abrashe umama ekhaya angabitsala ba hayi uyandiluma. So it takes away the focus ekutheni I'm getting the pain down there. The uterus is busy trying to expel this baby, but at least I've got somewhere where I can take off the pain apha kulo tata ekhaya.
Good. Take us through birth trauma and birth injuries.
Thank you.
What is that in the simplest possible language for all our viewers to understand? Because this is a very common topic and a very painful topic. Birth injuries and birth trauma. Yintoni loo nto?
Ndiyafuna uqala ndenje nje i-trauma konzakala okanye ukulimala, whether it's the whole person where the person dies or the organ or limb or part of the person kuthiwe wonzakele. These are injuries ezithi zenzeke during the birth process. And zintathu ke into eziye zibe ngonobangela. In fact zine eziye zibe ngonobangela kwezinto ezi. We're talking of powers. We're talking of the passenger. And we're talking of the passage. The powers ke kukucontractor kwesibeleko uterus when it's trying to push the baby out of the uterus. Ba hayi phuma ngokuxesha lokuba mawuphume lifikile. The passages le ndlela aphuma kuyo umntwana from the uterus through the vagina to the outside world. And the passenger ngumntwana lo ufuneka iphumile. Depending on the size kufuneka senze a proper assessment yoba is this baby going to be able to make it through this passage? Are these powers going to be strong enough to be able to expel this baby? As much as when we want to define birth process, is the process where the baby or the fetus, as we call it, is expelled. When we talk of expel, it's a forceful push. And as a force case, as you measure, and we can tell that the contractions are strong now, the contractions are weak, and this is the decision that we have to make. Contractions are not as strong enough, and assisted delivery. And this is one of the two major means of delivering a baby. It can either be natural birth, where umntwana comes out normally as the second type being the assisted delivery. Apho ke ngokusetyenziswa izixhobo ezithi zincedisane nolomzali ukukhupha lo mntwana. Izixhobo can range from anything like forceps deliveries, episiotomy cut, yes. Even the very, very commonly and overused model of delivery, which is cesarean section. And I must stress that cesarean section is overly used these days in private practice in particular. And omnye umzali uyakwazi ucelela athi hayi mina ndicela ubeleka ngesiza. This is not a very preferred way of delivery at all. Ndifuna abantu bakuthi I understand into yoba indaba ye-delivery is a natural process. Thina singogqirha singena only xana kukho ingxaki. Hence ndisithi powers, passages, and the passenger. I-passenger inikeze ingxaki ezi-trauma, ezi-injuries zenzekayo ke ziyakwazi uba kanti zenzeka kumama lo ubelekayo, because when we talk birth trauma, we're not only talking birth trauma pertaining to the child. Kuyakwazi uba birth injury eyenzekayo yenzeka kumama. During this delivery, kuyakwazi uba the process of njengoba ndisithi ezi muscle contractions ziba so strong to an extent that uterus itself, it can rupture. They can be so strong to an extent that placenta, where the baby receives all nutrients, it can be displaced or it can sit right in front. So it ruptures before time and all that. Secondly, as injuries ziyenzeka emntwaneni or both at the same time. The worst case scenario, kumama nomntwana. The worst case scenario is when we end up with a dead baby, dead mother, or both. So these injuries are as bad as that. Umkhulu becala, birth traumas, zizinto ezenzekayo that we don't even notice, and Mother Nature takes care of most undetected birth traumas, and ziphinde ziziphilele ngokunokwazo. Eziye ke ngoku zisibeke ematheni zezi ekumele uba thina singogqirha sihlele si-awake all the time. Athi umuntu ngala moment azicingele uba unto ngayo, akwazi uattend ii-clinics, akwazi ukuattenda oogqirha, akwazi ukubhuka ngexesha. Those are some of the things ezinothi zi-avoide, ziprevente ezi birth traumas and injuries zinokwenzeka. Ngoba kaloku sizakwazi uku-assess into yokuba lo mntwana wakho mama umkhulu kakhulu, especially kumzali umama o-diabetic, because they tend to give birth to abantwana abakhulu kakhulu. We call them IDMs, infants of a diabetic mother. So abo ke ubukhulu becala, they end up delivering a cesarean section. This is where I said earlier on, we only come in xa si-anticipate into yoba kuzawubakho i-problem apha, and then we chip in. Now, birth trauma would refer to any damage eyenzekayo emntwaneni, whether as a whole baby okanye ebuchotsheni okanye kumalungu omzimba xa sizamtsala sizamumkhupha, and which means kuzafuneka kubekho oomama abakwazi uyenza le process xa igqirha engekafiki, midwives. Like I said, it's a result of physical pressure. Uthi nje bephuma phaya asqueezeke, hence kudla ngokuzalwa abantwana abavele bebe ngathi banedumakazi elikhulu, which we are going to refer to as we go on. Now, it encompasses zonke ezanto zithi sizifumanise ebantwaneni after delivery, whether zezinto kuthiwa zi-cognitive injuries eziye zibahlela abantwana, where umntwana becomes a so-called vegetable, ichaphazeleka ingqondo, mhlambi ne-muscles zakhe zingakwazi kwa ukusebenza, abe floppy okanye abe stiff. We get abantwana abathethwa ngoo-cerebral palsies and all those kind of big problems esibanazo. I-birth defects ne-birth trauma, ndifuna kubekho umahluko owenziwayo ke apho, which lawyers don't actually make that contradistinction between birth trauma and birth defects. Birth defects may necessarily be izinto that can be unavoidable, ziyakwazi uba zii-results ze-infection athi umzali ezichole esakhulelwe. Iyakwazi ukuba zezaa ngxaki zoba umama ozawuzintyintya ngotywala eshushu kuzalwe umntwana one-birth defects. We call them fetal babies. Now, those are the problems that we tend to get, and the they don't make umahluko phakathi kwezinto ezo. Uba ngoba kuzelwe umntwana bakwazi uba bathumele umuntu bathi, hayi man, khona into wrong nalo mntwana, we can make money out of this. That's a topic for another day. Hence I say, in illegal fraternity, they make use of birth injuries to make sure that they get the best out of that, and discourage that from happening, because if we do, we will end up with abazalisi, a labor ward, abangakhathaliyo, which is not what we want to see as a medical profession. I mentioned intoba ingxaki ziyakwazi ukwenzeka kuba zizenzekele zi-birth trauma, birth defects, and unfortunately medical malpractice, which is what has caused kubekho poverty of obstetricians out there, because obstetricians ezininzi, they are chased out of practice because they are having to pay medical protection fees of over R1 million, and that is a lot of money for insurance only. And imagine somebody having to pay over R1 million, 1.5 million, just to say, in the event that I get sued, I need my medical cover to help me. I don't think for a moment that there's any sound-minded medical doctor who goes out to practice to cause harm, because our teaching is first do no harm. That is our entrenched teaching that we grow up with from the time we want to be medical students and doctors. Malpractice has been the nerve and the thorn that has been afflicting society.
Kuloo kanye Dr. Mooi, ndinothisa into yoba even obstetricians and gynecologists ezininzi, some of them, they retire from obstetrics, but umntwana uzobelekisa ndizawuqhuba negayini qha kuphela. Ingaba unobangela wale nto, is it because of as birth defects and birth injuries okanye kokuleqwa ngamagqwetha?
On the main, Dr. Tebelele, it is indeed the exorbitant fees that they are paying kwi-insurance. Let me make an example. If umama uyo deliver by cesarean section, udoctor gets out of that a mere between 3,000 to 6,000 rands. That's how much he gets out of that. And if you deliver 10 babies in 1 month, you are just not going to be able to make up for that insurance cover. Uzakuthuka yena umuntu athi, but the delivery cost 55,000 rands. Not that all of that money goes to the doctor. So that's one thing. Secondly, you can be sued until you are the age of 80 years old if you retire at the age of 60. This is how it works.
So usenolandelwa zinto zakho ubuzenzile kula process onceda abantu until uyoreacha u-88 usale kwazi izinto ezingasaungeniseli nemali. Masibamba apho Dr. Mooi. Masibamba apho before we get sued.
Indlela enyuke ngayo medical protection cover for obstetricians. In 2017, in UK by 925%. That's how exorbitant these guys are paying. That's why you don't see much of them. And we only have 1,000 practicing obstetricians out there. And the number is expected to come down because uninzi lwabo, they are leaving the practice of obstetrics. Uninzi lwabo bagxila isikakhulu kwicala gynecology, because obstetrics tend to follow you sometimes to the grave. Ngoba bensathi if umntwana kufunyaniseke into yoba une birth trauma, la case yakhe indlela ecalculator ngayo ayifani nalento kuthiwa i-case prescribile after 3 years. La case yakhe i-prescription yayo, it starts counting when the child turns 21 years old. You can imagine that case can drag for up to 24 years. That one single case, 23 years down the line in your practice, ufikelwa zileta zamagqwetha kuthiwa la mntwana wambelekise 21 years ago. Here we are. Now, zooming directly cases that we commonly see as birth traumas, we're talking about brachial plexus injuries. Brachial plexus le network yemithambo elapha engalweni ebanga ba umuntu akwazi unyusa ingalo avale isandla avule isandla. It's a network of nerves elapha egqalabeni. Now yenzeka kanjani uthi xa umntwana xa ivela umuntu ke ongenaso iskill sokubelekisa afuna ukutsala le ngalo atsale umntwana ngengalo and kuzawuthi gqi umntwana ke enengalo abnormal. That is definitely a cause for concern ngoba abantu abaninzi they either don't know what to do xa umntwana elola hlobo athi umuntu niye masendiyeka le into mhlambi ufuze umkhulu wakhe, which is not the case. We know that it's a type of a birth injury. We're talking of a Bell's palsy. Bell's palsy, rather, Bell's palsy, it can be as a result of a birth trauma, but most of the time, yindo ethi ibe khona as we grow. Easily managed. Funeka ithi kana ivela ikwazi utreatwa by somebody who knows what they're doing. Caput succedaneum, kukana kuvela bengathi kudumbe kakhulu apha ebuchotsheni, nayo le it's a self-limiting problem. Xa sithe nge-careful hematoma, sokuba kukho igazi ke ngoku, it's a bit of a tricky one, that one. Sokuba kukho igazi elikhoyo phaa ngaphakathi, uphele umntwana ngaphakathi, hence bendithe kuye kunyanzeleke into yokuba senze a decision yokuba are we going to allow lo mama abeleke normally, or are we going to assist lo mama abeleke by assisted delivery, or sizamenza i-cesarean section. Kulapho ke ngoku kubekho ne-bleeding. And xana ikhona i-bed kakhulu iye bikhona nalapha emehlweni, that means some of the blood vessels ezingaphakathi entloko zidlabukile, and it doesn't usually lead to a permanent damage ezo ziyi-2. La bleeding lapha emehlweni idla ngoba iyazenzekela without the presence of the two or caput okanye i-carpal hematoma, and we just call it subconjunctival hemorrhage. Ezinye ezenzekayo zii-fractures. Ndiyafuna ukugxila into yoba ugqirha goes there with a sole intention of trying to assist the delivery, but by so doing kuye kwenzeke unfortunately abe stronger than kanye apply a force which is rather stronger than the bones umntwana can take kubekho ezo fractures. Thambo lithanda ukuphuka msinyane le nto kuthiwa i-clavicular fracture, i-clavicle. Asphyxias
umntwana azalophuka ingqosho.
ophuka ingqosho, and ke le uzawuba nalangalo ke ngoku, but ke fortunately that one iyakwazi uphinde ihilishe laa nto, especially if izawukwazi udripeka kakuhle. Ii-cases ezithanda uba nobuzaza zezi I still feel we have no contribution in causation zazo. Things like spina bifida or Down syndrome. Apho inqashi eba khona ngakugqirha isekutheni you have failed to make a proper investigation and diagnosis through the usage of the tools and processes onazo as a doctor, including ultrasound and particularly as the latest ultrasounds esizisebenzisayo, which can pick up as defects, whereby uzawukwazi uadvisa umama lo uthweleyo into yoba mama lo mntwana umthweleyo there's a big chance that uza kuzalwa enale ngxaki. Angathuka umama umntwana sele lo hlobo abe kanti khange abe prepared. And during that process, uyakwazi ukumdibanisa ne-social workers, ne-psychologist, ne-psychiatrist, abe prepared for this child. Akho nto ibuhlungu njengomntwana ozawufika abe engalindelwanga and uyazi i-stereotype esikhoyo kubantu abangootata. Uzavela athi, hayi, ayingowam lo umntwana. I mean, that on its own, i-cause a-crack kulo mtshato esicimba thina uzawudityaniswa ngulo mntwana ufikayo. Uzawukhonjwa kulo sisi athi khona apho uphuma ungena khona, because thina apha emanantsikeni asibi nabo abantwana abanje.
Then afuna umdisowna lo mntana.
Yes.
Kufuneka ukwenza i-paternity test and so on. In the interest of time, masijonge apha kumama. Abama bathanda ukrazuka kubekho into ekuthiwa zi-first degree tears, second degree tears and so on. Ingabi nayo into enoyichaphazela loo nto kulo mcimbi wolandelelo koogqirha ngendlela wangakhathali. Secondly, ingaba inakuchaphazela ootata kumcimbi we-sexuality nomama going forward.
We're talking of tears ezenzeka during the birthing process itself. I need to quickly say, ziyakwazi ukunyangeka msinyane ezanto eza zingakhange zenze unobangela omkhulu. Ezinye zezi tears sizenza ngokwethu. We call them episiotomies. We cut. So I find no reason why there should be a lawsuit against ugqirha. Yes, lawyers will try their luck. There's no way that umuntu onoswishwa ngumntwana lo because umkhulu kangakwazi ukuphuma kakuhle. And the person to be sued is the passenger himself. So when we cut you open, we are trying to make way for the passage. And mind you, sekuleli xesha ngoku akusekho ukuthi stop the process, let's go and do that. Umntwana intloko seyiphumile almost all the way out. But we need to make sure that that tear doesn't get out of control. Kanti xana siyenze ngokwethu, it becomes a controlled tear. So it should not affect sexuality because that is usually way up vagina and it's stitched and it heals far better.
So in other words, it may not even affect issues of sexuality going
not
forward.
At all.
Thank you very much, Dr. Mooi. Because of time, the topic is quite huge and the topic is quite broad, but I think you've touched all the important matters. Our viewers, thank you for being with us. This is Dr. Tebelele with Dr. Mooi. We're talking birth injuries and birth defects. Thank you so much. I hope you've taken all the lessons. Please follow us on Facebook, Aphile Communications, as well as YouTube, Aphile Communications. See you next time. That's the end of our program. Thank you.